Okay guys, so you know where to find the incident accident report. Now we're going to go through the proper way to fill one out. So I went ahead and used myself as an example. So we're going to say that Brittany Evans, date of birth, the time of the incident, or I'm sorry, the date of the report took place, and then the date of the incident and the report are going to be the same day. Always put the time of the incident. If someone falls in the common areas, I'm able to look back at cameras to see, double check, did they hit their head? Did they actually fall on the side that they're complaining of pain, just to give me a better reference? Is there things that we could have done better at that time? Were staff members alert and present at the time of fall, or was there no one in the common areas at the time of fall? That's really important information. And here, you're going to mark all that apply. If you physically see the resident fall, then you can mark this box. If you're observing someone in their room or you come across them and you did not actually see the fall, please put other and specify. And the verbiage for that is resident observed on the floor. So we're going to use this as an example. Resident was found on the floor in her bedroom. She was lying on her left side at the foot of the bed. Head of the body was located facing the window. So now we have a little bit of a visual picture here to see exactly what position they were, and just to see placement-wise how that fall could have potentially taken place if they're not able to verbalize what happened. Here I'm going to put resident states that she tripped over her walker and lost her balance. Sometimes residents are going to be able to give you information and sometimes they are not. So if they're able to give a statement, always put that in there as a reference point. Patients state that she did not hit her head, but her left shoulder was hurting. Well, we can say she fell on that left side, so that makes sense. She was able to give a pain scale rating of 7. Like I said, this is very dependent on the resident as well, but what you can put, resident was, there was facial grimacing, she was moaning, hollering, or patient was inexpressive and smiling. Those are helpful and to determine rating of pain. Then you're going to put what you did as a result of that fall. So you're always going to be, nurse was called. She advised to, and what I tell you to do on the phone. So I'm always going to ask you to obtain a set of vitals. You can start to get those vitals before you call me. That way when you call me, I have that information. Perform range of motion exercises. Every time someone falls, we're going to let them stay where they are at. If they are antsy and trying to get up, then we are going to obviously accommodate that. Preferably, we're going to let them stay still. We're going to be like, okay, I want you to lift your arms for me. I want you to make a circle. I want you to bend your knees for me. We're going to test all the range of motion exercises and make sure there's nothing broken before we lift them. If someone is having major neck, back, or head pain, we are not going to move them at all. If they're in that much pain, we don't want to risk paralyzing the patient. So we are going to call 911 and we're going to let them assess as soon as they get here. And then usually we're going to put resident, or in this case we're using me as an example. Brittany was able to move all of her extremities normally. Once it was deemed appropriate, the resident was assisted with a 2-person transfer to her feet and was directed to her recliner. So you want a beginning, a middle, and an end for all falls. Usually people leave me a sentence or two. Resident fell on the floor by the nursing station. That is not enough information, so please make sure you fill all of this out properly, and then make sure you're putting who's completing this form. That's really important, because if I have questions, if there's missing documentation, I'm going to reach back out to you and I'm going to say, hey, I need you to give me a little bit more information. Where did this happen? I need to know where, and that's usually left out too. And then if there's any other team members that are assisting with a fall, whoever's there working with you, whoever's helping get vitals, get them up, make sure you put them on there as well. And then every single person on shift of that fall should be filling one of these out. Whether you saw the fall or not, you should just be putting a good example. So say you're the housekeeper and someone falls in the living room, you're just going to put resident was found on the floor in the living room. This person, this person, this person are the one that assisted with their fall. If there's ever documentation purposes that are needed for falls, every single person has to be accounted for. And then if it was witnessed, then you'll put who witnessed here. If it's not witnessed, make sure you check every single box on the way down. This one is really important. Indicate the date and time the facility nurse was contacted. Put the date and the time, but also please put who. If it's someone that took care of the fall besides myself, sometimes I need to ask them questions. But to clarify, so Monday through Friday, if someone falls at nighttime, please call me. I am the person that is on call Monday through Friday. On the weekends, it'll be whoever's on call that weekend. Call starts 5 p.m. Friday and ends 6 a.m. Monday morning. We're going to take vitals at the time of the incident. It is very common that some of these vitals, especially blood pressure, it may be much higher than their usual. This is for many reasons. It could be one, cause of fall, two, they're a little shooken up. And so then you'll notice, okay, after 15 minutes and after an hour, those are going to probably go down to normal ranges after they've had time to settle. Make sure you're getting every single vital. The only time that you need to do an AccuCheck is if someone is diabetic. So if you notice someone doesn't look quite right and they fall, we can say, I wonder if that was low blood sugar related, and then you'll need to put an AccuCheck there. Right now we don't have any diabetic patients, so we don't have to worry about that. Side of pain, we're going to ask them, we're going to say left shoulder, or if someone's nonverbal, but we are doing range of motion exercises, and as you're doing that left side, they start to flinch, you can put that information here. If they're bleeding, put where. And then also, so say someone falls, hits their head, but they have a skin tear, and then they immediately are developing some sort of secondary, you're going to go back up here and you're going to mark skin tear, and their bruising is starting already. And then range of motion, you're going to put normal. If someone's really contracted and they don't have good range of motion anyways, we'll use Judy for an example, then obviously these are subject to change a little bit. And then the rest of this is going to be for nursing. So nurses, if you are doing this training as well, make sure you're putting here who you've contacted. Every single family member needs to be contacted after a fall, and then put your information here. If they went to the emergency room, you need to be calling the emergency room, getting an update for them, and making progress notes. You're supposed to be calling a secondary family member if the legal representative does not call. And then we're always going to call and notify the primary care physician too. It could be call or email depending on the time of day. And then this is going to be for nursing also. So we're going to have to put fall precautions, what we did. Are we going to have a stand-up meeting and have a huddle? Are we going to add a chair alarm? All of these interventions need to be put in here. And then once I complete the incident accident report on Point Click Care, we're going to add when we did that here. And that's something that state needs to be notified of as well. And if you guys have any questions, please let me know. Like I said, some of this is subject to change depending on the person and the type of fall that we have. It does not have to be just a fall to complete an incident accident report. As you notice on here, if someone has a burn, a cut of any kind, behavior, this is a big one. If someone is out of the ordinary, they're having behaviors, if they're hitting, if they're combative with another resident, any of those types of behaviors, they need to be documented here. Elopement, we have a gentleman right now that was an issue, so make sure we're doing an incident report just saying, this person eloped and what time they got out of the building. And as always, if you have any questions, please let me know. Thank you.